Hi, I'm Sandra Clements, and I had started using Dr. Shoemaker, I guess, about 18 months ago. When I first came to him, I was having trouble. I had had dentures for 22 years. I had had cancer when I was young, and due to a side effect of the chemotherapy, my gums just literally let go of my teeth. When I found Dr. Shoemaker, he did let me know, he explained to me that it was going to be a pretty difficult case because there wasn't much there to work with. However, he assured me that I would be able to have normal teeth in my head again and enjoy everyday life and get the quality of life I had lost back. I come in thinking that I was just going to have new dentures made, and come to find out I had lost so much bone that we could not do anything denture-wise any longer. Which had made a huge impact. I couldn't smile. My teeth wouldn't stay in my mouth regardless of how much glue I used. So after meeting with Dr. Shoemaker, he let me know that I did have an option. I did not have to be toothless at 57. We talked about doing implants, but before he could do that, he was going to have to do a bunch of bone graft because I had had so much bone loss that there was nothing to actually fasten anything to. I did my research. I'm kind of funny. When I start to do anything, I do background, and I actually try to reach out to people on Facebook, this, that, and the other, that had used him, and every person that I had spoke with said that he was phenomenal. So it has been a really long process, about 18 months worth, but been the best decision I've ever made. I can eat what I want. I can smile and not be afraid that my teeth are not going to stay in place. First time I have actually seen my actual smile in probably 25 years.